I might watch here in Florida. You on there, Rich?
And it is 7 o'clock in Texas and 5 o'clock in California, right?
Well, I guess we're going to get ready to get going. Welcome, everybody, to Dental Sleep Medicine. You can do this, an introduction and overview of dental sleep medicine by myself, Guy Yatros, and my partner there on the other end, Rich Drake. We're going to get started, but we want to thank Keller Laboratories, first of all, for promoting our course. We work with Keller, Rich, we've been working with them for years, 7, 8 years at least that I can think of, and they do the majority of the devices I do. We send a lot of them to Keller, and in addition to being a great Crown and Bridge lab, they do a great job on a lot of these mandibular advancement devices that we do for dental sleep. The Clear is one of my favorites. It's one of the newest ones they do. I wear a device every night myself, and I say this with all sincerity. It's one of the best values out there in dental sleep. For $2.99 without any extra add-ons, it's a great device. I had one of the first ones ever made, and I've been wearing it for several years now, and it's the device I put in my mouth more than any other ones every night. So if you want to know more about that, feel free to contact us or Keller Labs, and of course they're the maker of the NTI as well. So and we do a lot of that with our TMD patients as well. So there we are. I'm on the left of your screen as you're looking at it, and there's my partner Rich. We've been doing this a long time, haven't we, Rich?
We have. You might have to adjust your screen so that I don't get a little flash off my forehead there, but we have been doing it a while, and I think between us we've done several thousand devices. So Guy and I hooked up at an Academy of Dental Sleep Medicine meeting several years ago, and that's what we do is we help dentists do this. You know, we like to teach dentists about this, and we formed Dental Sleep Solutions. And that's our mission statement. You guys can read it there. And we really do provide solutions for dentists who are doing this, whether this is the first device you've ever done or whether you've done 1,000 devices. We have systems in place, and we have put thousands and thousands of hours into doing all of this stuff. So we're not just software that people think about us. We do other things as well, too, right, Guy?
Yeah, everything you see on your screen, away from education to insurance to training and support, and it's an all-inclusive system. So if anybody wants to try out our system throughout the evening, just type in free trial, and Eric will be happy to contact you tomorrow and set you up with the free trial, no obligation. You can try that out. We have the only dedicated dental sleep search engine that I know of, and Snoozle is what we call it, and it's really growing in popularity. So a lot of the questions that you may have as dental sleep dentists, when you're part of our system, you can look into Snoozle, and if you don't know the answer, you can Snoozle it. And one of the things we do really well, I think better than anybody in the country, is teach dentists how to do this. And these webinars are great. We have webinars built into the online training we have, but nothing beats a hands-on course. If you look at these courses here, the next one coming up in Philadelphia, they're a great value at $9.99. Includes a sleep test and a dental device made by the lab. So, I mean, that alone is worth the $9.99 for a 2-day course. If you type in during the webinar tonight that you want to attend one of the courses, just type course. If you know the city, put the city, and you'll get $200 off if you type that in tonight and register before the week's over. And just Stacy will contact you about that. So that's enough of the commercial. If you want more information, we will put this up again at the end. And we have really great reviews on our courses, and we really enjoy doing it. So I think I'll talk about this guy, if it's all right, Rich, since he was my patient.
Can I just say he's kind of goofy looking? He looks really happy. Is this like right after you got him off of nitrous or what?
Yeah. Well, just pull the nitrous off and snap the photo. But he's a fun guy and was my dental patient for years. And, you know, one of the things that we want you to do by the time this webinar is over, if this is one of your first exposures to dental sleep, is, you know, if we put this up on the screen and you were attending an aesthetic course or an implant course or even an occlusion course, you'd be looking at a lot of things here. We'd be looking at curves of Spee and Wilson and, you know, the crown-root ratio, Goldman proportions, staining of teeth. Of course, we might notice some wear, but, man, when you start looking at patients differently by the end of the night and you see things like tongue size and neck size and why is this person possibly grinding their teeth, and, you know, in our courses we go into this in more detail, but start thinking about your patients as a whole and why they do things. And we're going to talk a little bit about bruxism in a bit that I think will open your eyes in particular about this guy. So this is changing it, Rich. I mean, this radar is expanding, in my opinion.
Yeah, I had my first exposure to dental sleep medicine on the course 14 years ago, and literally came home and told my wife I was selling my practice, and this is all I was going to do. So that's all I have done for 14 years now. So, and I haven't had to move yet, so that's good. But it's a whole lot easier now. If you guys are just looking at getting into this, your timing is much better than ours was, right, Guy? Because we were the first guys through the wall, so to speak, and that guy always gets bloody. It's a lot easier now. Insurance companies pay for this, but you got to know what you're doing, right? More patients are aware of it. So I think it's one of those things where the more you see about this and hear this, what's the saying about the tide, Guy? An incoming tide raises all boats. And you guys, we'll give you a couple of little things that from the industry itself, that this thing is growing and it's on the market, and we're glad that you guys are here to learn a little bit about it.
Absolutely. And one of the fun things about this is, maybe you're at a crossroads in your practice. Hopefully after this webinar, you'll at least consider this. What are we doing? What were we taught? We were taught to save teeth, and we think that's real important. Still, I mean, teeth are certainly significant. We spent all of our lives learning about it. But, with dental sleep, you can actually save lives. And I couldn't find a cool graphic that had a road right down the middle, because that's really what you can do. You can do both by incorporating dental sleep into your practice, and it's very rewarding. We could spend the whole hour just talking about how rewarding and fun it is. But at the very least, when you leave this webinar, if this is your first exposure to dental sleep, we think you should do this. You can do this, but at the very least, you should be obligated to start looking for this as a healthcare provider. It's if you care about your patients and want to help them with their health as a whole, we should be looking for this in our practice. And Rich was talking about how things have changed, and we don't have the brand new practice parameters into this presentation, because they literally are hot off the press. But 2006 kind of started changing my life, Rich. That's when in and around when I met you, and decided, because of what the American Academy of Sleep Medicine said, and their standards prior to 2006 really weren't as favorable for dental devices. And in 2006 it changed to you can read it yourself, but you want to just paraphrase it for them, Rich?
Yeah, you can use these things now. I want to back up a little bit. When you said your life started to change, was it because of parameters or because you met me?
Both.
Okay.
Probably the latter more than the former, but yes, we work a lot more now, but we have a lot more fun, so it's fine.
Yeah, but back in those days, Guy, people questioned whether or not a dental device worked. The medical community did. The dental community did. Now we don't have to question that. They work. Okay,
right.
They really do. And so for people who have less than severe disease or who can't tolerate CPAP, we should at least be looking at whether or not a patient is a candidate for this. That's what you got to take away from this.
Absolutely. And, as a first line of therapy, I mean, before you had to have your uvula cut out, try a CPAP first, and then maybe a dental device. And in 2006, the research showed, and now we can use it as a first line of therapy for mild to moderate disease and anybody who just can't tolerate a CPAP. And that's when Rich and I started Dental Sleep Solutions. So we've been doing this a long time, but really about the last 9 or 10 years, we really decided this was going to be our lives because, the tide was turning, and it is turning. It didn't turn quite as fast as we thought it would, but that's good for everybody who's getting involved now, because the flood is beginning, as we'll talk about in a little bit. And, what we're trying to do here is help a person with this problem. And I don't think I know if I can get the sound to work, so I'm going to try to do that. I'm going to play this video of someone having an APNIC event, and Rich, you can kind of walk them along as I play the button here for a second.
Okay. This guy's in a sleep lab, right? He's got belts on there. So you saw him, he snored a little bit. He got a couple of breaths. He's not breathing right now. You can count how long this goes on. This goes on for quite some time. You see his abdomen starting to move. You see his diaphragm moving. He's he's making an effort there to try to breathe.
He's basically got a cork in his mouth. You know, he can't get any air through there. Oh, he didn't die. I was worried he hadn't died before, but there he goes. All right. Well, you know, you get the idea of what's going on here. I'm going to stop the video for a second. You know, we think about treating our patients with TMD and headaches and a lot of things that happen. Can you imagine you go through that a few dozen times or a few hundred times a night that you may have elevated hypertension, you may have jaw hurting in the morning, you may have morning headaches, you may not feel refreshed. And really what's happening here is the patient falls asleep, and what happens is the airway narrows. It's not a complicated thing. As your airway narrows, the air goes quicker, it starts making a noise we call snoring, and eventually it collapses to the point of apnea, and then we become hypoxic. When we become hypoxic, we get aroused from sleep into a lighter stage of sleep. We have some pituitary action. We contract muscles, which include a lot of the muscles we deal with as dentists. The airway opens, take some big deep breaths, and you saw the whole thing starting again. This can happen, maybe a dozen times a night or maybe hundreds of times a night. And most of the time,
that could happen 100 times an hour. You know, we see these numbers. So we look at, you know, part of the way we measure this disease is through an AHI, an apnea hypopnea index, or RDI, respiratory disturbance index. So we don't want to throw around a bunch of terms to confuse anybody, but that's just the measure for how many times you quit breathing per hour. And you look at that guy, and you'd sleep next to that guy at the fishing cabin or the hunting cabin. You wouldn't even say he snored, guy. He only getting two or three breaths a minute, right?
Right. I mean, and then he's quiet because he's not breathing. And the health ramifications we're going to go over in a few moments are just it's related to so many different health problems and ultimately a death in some cases as well. So it's very significant for us to look at this. And it's not a complicated physics problem here. I was in engineering before I went to dental school, so I like stuff like this. Maybe some of you don't, but just to dumb it down here, it's really not that complicated. You've got the pressure of the air pushing in, the pressure of the atmospheric pressure pushing in, and then you've got the pressure of the airway actually pushing out, and the muscles pushing out. So it's kind of like a balloon. You fill a balloon and you start letting air out of it, and so at some point it will collapse in on itself, and that's what happens with apnea. We don't hold our breath during apnea. What we do is we typically breathe some of our air out until the pressure on the outside becomes great enough to collapse the airway, and then we have a collapsed airway. So, you know, it's kind of a continuum here. You know, the air goes through our airway, and we all have that possibility. Snoring, it's constricted, and then as you can see in the middle, apnea is more or less a complete closure of the airway that prevents us from breathing. And again, most people who have this problem don't know that they do.
What's that big thing in the middle there, besides the brain, right? The tongue, right?
The tongue. And, you know, we don't realize this. I use this slide, Rich, with my patients. So we actually had these printed out. We talked to the patients about, wow, look at this big thing. That's the tongue. And what is that tongue? It's a muscle. And at night when our muscles are very, very relaxed, and at some points during REM sleep, they're almost paralyzed. Some people consider them paralyzed. And so if you're laying on your back, can you imagine, you know, what's happened to that muscle? It's just closing off the airway, and we have that obstruction. So it's just a pretty simple problem, but it's really not that easy to fix. And what are our treatment options? Well, I'll show you a slide at the end. Most people who in our country who have this problem get a CPAP. As we just showed from the practice parameters, dental devices are indicated for mild to moderate apnea, and anybody who doesn't want to wear a CPAP or can't wear a CPAP. And then there's some other things, surgery. You can roll people over on their sides maybe, and that'll help. But most surgeries are pretty invasive and less predictable than dental devices, and losing weight might actually help. But if according to the practice parameters from the American Academy of Sleep Medicine, the two on the top there are the first line of therapy, not the surgery, which a lot of people, even in the medical community, think. So
CPAP, remember CPAP stands for continuous positive airway pressure, right? And that's the mask that goes on. We got a couple of those slides, but when we look at these dental devices and we talk about what you can do, the American Academy of Sleep Medicine is the medical community that's behind this. Okay, they're the ones that looked at all of the data, all of the studies, and they say, you know, these things work pretty well. So again, CPAP is a big industry, and it's not going to change overnight. But we'll show you some slides later that look at, you know, where dental devices and CPAP fit into the global market. And again, you guys are getting into this at a good time. That things are starting to change, and but we make a lot of these. Okay.
Yeah, and I think the key point on this slide when we're talking about, you know, so the American Academy of Sleep Medicine has dental devices and CPAP. So as we compare the two, dental devices have a better compliance. More people will wear them opposed to CPAP, and CPAP has a little bit better predictable efficacy. But really, the effective treatment is a factor of both of those. They're the efficacy of the treatment times the compliance. And the new practice parameters that just are hot off the press basically are looking at this a little differently and realizing that overall dental devices work as well as CPAP because the one balances out the other. None of them work perfectly, but they both dental devices and CPAP can be effective treatments. And one has a better compliance and one has a better predictability as far as efficacy goes. And so, you know, here's your CPAP. If you don't know what that is, it stands, as Rich already said, continuous positive airway pressure. So PAP is the positive airway pressure. It basically blows the airway open as a pneumatic splint. $4 billion a year, it's a lot of money spent on CPAP in our country. And I think that's even an old figure if I'm not mistaken. You know, when we look at this as a health issue, and this is disturbing. Most people who have apnea don't know they have it, and then the ones who have it aren't either wearing their CPAP every night or they haven't gotten treatment. And so when you boil it down to who really has this problem, and then they really have an open airway most of the night, it comes down to 2 or 3 out of 100 really have a totally effective treatment for this serious medical disorder. And our question there is, you know, if you're thinking about getting involved in dental sleep, is this the time, or do you think there's a market for it? When you consider there's $4 billion a year spent on this, when a lot of times this fails if we consider a compliance in the you know 95 plus percent range. So I think there is a market for us. We look at these, you know, they've come a long way. I mean, aren't these a lot better pictures than the pictures we had in our slides 10 years ago, Rich?
Yeah, they are. But can you imagine, Gaff, you and I have been sitting around with John Rimmers in the early days when they were figuring out what CPAP was, and we said, hey, look, we'll just take this little piece of plastic and move somebody's jaw forward. Yeah, I think it'd be a whole lot harder to sell this now than it would had we been the first guy sitting there, right? But they were the first ones there. That's what a lot of the physicians know. That's all they understand. So those of you that have started to dabble in this, we feel your pain. We've been there, right? Because you deal with these physicians, and all they want to prescribe is CPAP. So our take on that is we want to challenge you guys to take those physicians one at a time and educate them. Get one of their patients, have a mutual patient, treat them, get them back to the sleep, to do a sleep test so that you can educate these physicians about this. And it does take time, and we feel your pain. We've been there, but it's changing.
Yeah, we don't want to talk bad about CPAP. We kind of poke fun at times, and I mean, but it really does work most of the time. But the real problem is a significant number of patients can't wear it. So we refer people for CPAP, and we do combination therapy where we do dental devices with CPAP. And Rich and myself, most of our patients come from medical referrals. So it is good to work with your physicians. But when you really think about this, why is CPAP objectionable? Well, here's some older pictures. You can look at this. You've got to be strapped and tethered to this machine that sits beside your bed, and the feeling of this air being pushed down your throat is difficult to get used to for many people, even though it's effective. I mean, you know, talk about John Rimmers and our friend there, one of the physicians. I didn't get this from him, but look at some of the first masks. I mean, good gosh, that was a hard sell back in the day. And even in my own office, this patient here, I took this maybe close to 10 years ago for a lecture I was doing. And you can see the technology has changed, but still yet, the lady was very stressed just putting it on her face in my office. Just you can see the like clamminess in her hands if you look closely, and you know, CPAP is not going to put us in.
I love this ad. You know, the guy with his CPAP, good-looking guy with the little bit of champagne on the nightstand.
That's a real ad I pulled off the internet, and my point, our point here is, you know, there's going to be a market for us because this is as good an ad as you can make for this device. And the fun part here is, look, as a dentist, you can screen your patients, you can help to get them tested, and you know, you can help facilitate that. And then when the patients realize they have this serious medical disorder, when they're given a choice between the CPAP and the dental device, it's kind of fun because you know what they do? They really want what we have a lot of times. And as dentists, you know, we spend a lot of time talking to our patients about the virtues of a crown or a root canal or implant. A lot of things maybe patients don't initially want, and we've got to talk to them about the why that this is a better treatment for them versus maybe a filling or something versus a crown. And what's nice about this is once they understand that this is a serious health risk and that they want treatment, they're going to, and most of the time, if they're a good candidate for dental device, that's what they're going to want. I can tell you, you know, I have an airway problem. I have apneic events, and for years I have not worn this. I wear a dental device myself. So, you know, I'm a believer and a user of the technology. So we're going to talk about risk in a minute, but kind of we're a third of the way through here. If you have questions, we do have everybody muted. I want to remind everybody of that. So if you have a question, go ahead and type it in, and we'll try to answer it along the way. We will answer questions at the end because we intend on being finished within the hour. And so just type the questions in for now, or you can raise your hand and we'll unmute you later. And again, if you got here a little bit late, you want to see a little bit more about our system for implementing dental sleep, anybody on here tonight wants a free trial, just type in free trial, and Eric will set you up with that tomorrow, or our courses will show you at the end of the night. You put down you want to go to one of those, and you'll get $200 off. So prevalence, a lot of people have it, right?
So who has this disease? You know, we think about our dental office. So you guys are doing dentistry every day. So you got hygiene patients coming in, you got restorative patients coming in. Most dental practices see 10 to 20 patients a day, okay? Across the United States, there's 180,000 dentists in the U.S. Some see more, some see less. But remember, there's 30, 40 million people out there that have this disease, and the older they get, the more obese they get, the more likely they are to have sleep apnea. So depending on which study you look at, it ranges from 15 to 40 million people that have this disease. So more than half of the population snores. You know, it's about 40% when you're 40, in your 40s, 50% when you're in your 50s, 60% when you're in your 60s. So again, you see a lot of this. I mean, look at that bottom statistic, guy. Almost 1 million people a year can't wear CPAP. 1 million.
Yeah, I mean, and that's, you know, if we just do nothing more than help those people, there's enough to keep a lot of dentists in this country busy. And these patients need the help. They truly do, and they want the help. So we don't have time to talk about marketing tonight, but that's who we recommend marketing towards, are the CPAP non-compliant if you're going to target one group. But look at the numbers here. I mean, we've already kind of hit some of these, but across the country, half of us snore, and 40 million suffer from this, 15 million in some different studies. Something a little different on here is, you know, almost half the diabetics, 48%. So if you just go back Monday and start looking at your health history and you got a diabetic there, you can ask them if they've been tested for airway problems. And if they say no, there's about a 50-50 chance, just shy of that. And there is for AFib. It's a coin toss, you know, whether they have this problem or not. And cardiac patients, this says 30% of the studies say as much as half. So it depends on, you know, which study you're looking at, but I think pretty safe to say a third or more of cardiac patients and a third or more of patients who just even have high blood pressure have this problem. So I mean, you go to your
can I ask you a question, guy?
Sure.
Why are you telling these guys this? Why are you telling them about all these people that have it? Because
we need their help.
They're going to ask, where do these patients come from? Right? That's what dentists ask us all the time. And the answer is they're walking through your door every day.
They're everywhere. And most people who have the problem, again, 9 out of 10, if you looked at the previous slide, don't know they have the problem. And we literally started this because we wanted to get more dentists involved. And we saw that this was a healthcare crisis that wasn't getting addressed. And not the, not to sound cliche-ish or I don't know what the right word is, but we truly were frustrated and felt that something needs to change. It's so rewarding to help these people. And part of our problem is not enough dentists know enough about doing this. So even if the physicians decided tomorrow to go by the practice parameters and start educating all their patients on dental devices, where would they go? You can't just willy-nilly start making mandibular advancement devices. You got to have a little bit of knowledge about what you're doing, and that's why we started. Now we have helped thousands of dentists start to implement this in their practices.
So one of the take-home things that I really want you guys to get from those last 3 or 4 slides that Guy showed was that one of the best ways to find these people is to review their medical histories.
Absolutely.
When these people walk through their office, are there any changes in your medical history? Yeah, well, my doc put me on high blood pressure meds. Oh, okay, well, how are you sleeping these days? Do you snore? Yeah, I snore like a banshee. My wife hadn't slept in the same bedroom for 10 years. The guy snores, he has high blood pressure. He's at 78% risk for having sleep apnea already. So as you think about this, people who are diabetic, what kind of medications are you on? Those are all red flags to help you guys find these people. So who said this? I want to die the way my grandfather did, peacefully in his sleep.
Well, certainly not the passenger's car who knew he was about to die. I mean, that's just to kind of get your attention, and it's making light of really not something that's that funny, especially when you consider the prevalence of sleep apnea even in commercial transportation drivers. So as many as 28% of the commercial drivers have at least mild apnea, mild to moderate apnea. So it's pretty significant. It's scary. More people die from sleepy drivers annually than drunk drivers. So I mean, just this risk alone. I even have personal stories about that as well that we don't have time to share in a 1 hour webinar. But we need to start looking for these things, like Rich said. We do have all kinds of tools to help you screen, and we'll talk about that in a minute. But again, this is a quick overview of why you should be involved and what this means to our patients. And I think this may be the most, I don't know if it's the most important slide, but it certainly is important because, correct me if I'm wrong, Rich, but isn't everything on that on the screen here independently associated with untreated sleep apnea?
Yes, it is. And when we look at this and how we compare this, we look at odds ratios. So when you look at MI or myocardial infarction, if after we adjust for all other factors, right, for somebody who with our known risk factors for heart attacks, if somebody has sleep apnea that's untreated, they're 3 times more likely to have a heart attack, 2 to 3 times more likely to have congestive heart failure, 4 times more likely to have high blood pressure. I mean, you just go right down this list, and all of these things are at least related. Again, relate these types of things when you review medical history to someone assessing someone's risk, okay, for whether or not they have that, because that's one of those things that we have to do is help people walk them down this path and help them understand that there's an issue there. But I think we treat this for 2 reasons, Guy. I think we treat this to help people live longer and to mitigate these health risks, right? Because if we treat their sleep apnea, we take that odds ratio down. We take them out of those high-risk groups. And the other reason we treat them is because they feel better. Right? They have more energy. They're back engaging life again and doing things. So we have the quality of life issues, and then we have the fact that we mitigate all of these other health risks in doing that. And it's very rewarding. I think the people that we get, that we help get into this and do this, that's what we hear over and over again, is how rewarding this work can be.
Yeah, and I think you put it in perspective for the patient. We help their symptoms. and we help them be healthier, their longevity, and not be a health risk. But why should we do this as a dentist? I think you hit it on the head, nail on the head, because it's the right thing to do. Because if we care about our patients and we're not just worried about the bottom line, I mean, we hopefully do care about our patients, but it's very meaningful work. I think that's why I personally have gravitated towards doing this, and this is all I do now as a dentist. And it's because it's so, I only have so many hours to spend with my patients and so many breaths in my life to take left, and I enjoy this that much more than I did general dentistry, even though I had a very successful dental practice as well. It's just so meaningful, and you can just change people's lives. So we are passionate about it, and we really do believe that you should be involved as dentists. It doesn't mean you have to jump off the deep end like Rich and I and just do it, but man, it can certainly add some income to your practice, and it can add some enjoyment out of otherwise stressful days to help people feel better and get those things, thank you a lot, hugs and things that you get from your patients.
So how do we know somebody might have it? What kinds of signs and symptoms might they present with? So they might snore, right? They might be tired and sleepy. They might have some of these other comorbidities that we've been talking about, as far as from diabetes to high blood pressure to the glucose resistance and intolerance and things like that.
That's the most common ones. I mean, here's some other ones, but we put those on the front because that's what we think of the cardinal signs: snoring, sleepiness, hypertension, diabetes, some comorbidities, as we talked about. All these other things, as we had on the other screen, some of them can be related as well. So you can see this touches all aspects of these patients' lives. And what we haven't touched on, Rich, is many, if not all of these, can be improved with treating of the apnea. I mean, including all the way down to sexual dysfunction for men and women, improvement in the hypertension, improvement in headaches, improvement in their glucose intolerance and results in diabetes and memory problems, acid reflux. All these things, once we get the airway open, we can actually medically see an improvement in those things as well, in addition to their symptoms. What about this one? I don't know if you can hear that. I'll put it on my speaker. But this is a reason to be involved in and of itself. I can hear it's going to come on in a minute. And this is somebody grinding their teeth. Yeah.
Oh,
all right.
That's worse than the fingers on the chalkboard, guy. Turn it off. Turn it off.
And I always think, man, it was at the crowns I just did last week, because I had a pretty big restorative practice at one point, and we did a lot of rehabs, and the patient would come in and break off their crown that you did, and maybe their teeth look like this person up here at the top to start with, and then we wonder why their crowns broke. And what would we say when they come and break? We'd call Keller and say, Keller messed up, right? No, sorry, Keller, we're just kidding a little bit about that. But, we blame it on the lab or on them. And, this was, I would say, the single most frustrating part of my restorative career was I didn't understand this the way I do now. And I'm not saying that we have all the solutions, but I tell you, when I used to look at what causes bruxism, and what type of disorder it is, I would have drank the dental Kool-Aid. I mean, I went to school at University of Kentucky, and I'll talk about this in this is my personal experience. And at Kentucky, we had a really good TMD occlusal instructor, Dr. Okeson. A lot of you read his books. His book's still the book that's used in a lot of the universities, the dental schools currently. And he's a wonderful man and incredibly knowledgeable. And what did he teach us? Well, there I was getting ready for clinic, by the way, Rich. I did graduate, so. But I moved to Florida, and Okeson was saying it's all about occlusion. I moved to Florida, and right across the bay was one of my mentors, Pete Dawson. And I even lecture for Dawson Institute now. And and I asked Pete 25 years ago when I moved down here, and I'm going through his stuff. And when I sold my office, by the way, I had 15 articulators, I think, that went with it. Because I mounted this stuff, and what did Pete tell me? Oh, you got a posterior interference, and that's why the person's jutting his jaw forward at night. That's what he told us. You can ask Whit Wilkerson, who runs the place now, and that's what we were told. It was occlusion. I went to Pankey Institute. all the stuff there, occlusion, and that was as little as 5 or 6 years ago. And by the way, I teach down at the Pankey Institute now, and we've changed our philosophy a little bit about this. And even Frank Spears, I had a conversation with him 6, 7 years ago at the Pankey Institute about this, and it was still the same story. We're jutting our jaws forward. It's everything to do with occlusion, and we could talk for hours about occlusion, and it is important. But is that the reason we grind our teeth at night? And I can tell you, when I started looking and reading, I read this book. You read this book, right, Rich? Principles of Practice of Sleep Medicine. It's not a
Yeah, in between reading spells, you could knock somebody out with it. It's a big old textbook, but it's a great textbook.
It is a great textbook. It's about 1,700 pages long. But this is, the people we just had on the screen were a lot of the dental gurus that some of you may be familiar with. And we've been listening to them about why people grind their teeth at night. And as I started taking my studying for my board for sleep, and as I started learning more, well, this book here, Dement, one of the authors, what's he, the father of sleep, they call him, I think, Rich? Is that his nickname? Yeah, so he's the father of sleep. So these guys are the gurus of sleep, and what they're saying is people who have OSA are 3 times more likely to grind their teeth at night. So if you have apnea, obstructive sleep apnea, we're going to see 3 times the prevalence of nocturnal grinding. And they're saying it has to do with this micro arousals where people are coming out of a deeper stage of sleep and coming into a lighter stage of sleep. I started doing a little bit of research about this about 4 or 5 years ago, and my prosthodontic associate at the time, I was discussing it with him, and I was asking what he was trained. And, they were starting to teach this a little bit at the University of Gainesville 5 years ago with this book from Levine. And when he pulled the book in and we looked in, what they were teaching is that, or you can read it yourself, but to paraphrase it, that we used to think bruxism had to do with orofacial discrepancies, in other words, interferences. But now that we know it's a minor role, if any, compared to the autonomic sleep arousal response. So that's also what we consider a microarousal. So what they're saying here is that this is that we're not sleeping well at night, we're waking up, and that's why we're grinding our teeth. Am I saying that correctly, Rich?
Yeah, I think it happens more than we'd like to think. There are other studies, and we can't go into all of these, but there are about 2,500 studies out there on bruxism now. Okay, and more of them. If you just narrow a search to the last 3 years, more than half of the ones in the last 3 years relate sleep bruxism in some way to the airway itself. So 10 years ago, none of them did, right? Very few of them did, and now most of them do. So I don't think it's the only reason that people grind their teeth at night, but I think it's one of the big reasons, and you simply can't ignore it. I got one question for you, Guy.
Yeah.
What's an articulator?
It's been a long time since you used one. Well, that's it right here. I think it's even a Benar right there. So I think that's even the brand name. But this was the, which one of these actually treats sleep bruxism? I should say sleep, not just bruxism. This was what we did in Okuson's class down in the bottom left. I call it the tap, tap, tap clinic. We tap, 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 and we'd grind these and get these tripods. And I finally got smart, Rich, and just got an ink pen out and drew little dots on it and went home. But snuck that one right by. But anyway, we would think this would work. And we've all made bite guards. Oh, sorry. We've all made bite guards for bruxism at night, some orthodontics. But, when we look at this, do these really decrease bruxism? I mean, they may protect your dentistry, which I think is a good idea. And they may decrease forces at which we can brux, but do they decrease incidence of nocturnal bruxism? And truthfully, the one that's been shown to do that is the one that you wouldn't be familiar with as a dentist, and that's the CPAP. And here's a study that shows that a CPAP on someone with OSA, we can decrease significantly the nocturnal bruxism. So here you are as dentists killing yourselves, making this occlusion perfect, and these people are spending all this money for you to repair their teeth that they have destroyed at night, and you're wondering why they won't wear a bite guard. What's going on? Why do they continue to destroy this? And I'm just telling you, we might want to look at their airway, at least consider it. And I'm with Rich. It's not all about airway. We don't want to get so narrow-minded that we're on the other end, but we certainly need to consider it. But if you ask the sleep physicians, what is sleep bruxism? It's a sleep disorder. It isn't a tooth disorder. It's a movement disorder. That's the way the physicians classify it. People who don't sleep well at night also twitch their legs at night too, periodic, what is it, periodic limb movement disorder.
Limb movement disorder. That's also
Right.
a movement disorder.
Right, that's bruxism of the legs, but we're not sending those people to the orthopedic surgeon to get splints because they're not destroying their legs. They're not hurting anything. We have to clean up the mess from this sleep disorder that happens to destroy teeth. And I think if you come to one of our courses, we talk a little bit more about that. We'll have you
We talk a lot more about that in our courses, and we just don't have time to do all of that tonight. But the take-home message from this very much is, if you're frustrated at a lot of these other things that deal with occlusion and grinding and tearing up your dentistry and things like that, don't just make everybody a night guard. Okay, talk to them, screen them, assess their risk for sleep disordered breathing, talk to them about getting a sleep study, right, and walk them down this path.
Absolutely. So, start thinking this way. This is more, I think, our opinion, but, why do people grind their teeth at night? They just keep banging their front teeth. At some point, it has to do with the airway. They're moving their jaw to get their airway more open, and oftentimes. And you've all seen this. A lot of you have it. If you want to connect these six dots with 4 lines, the only way that I know of doing it is to do it like this and to think a little bit outside the box. And that's all we're hoping that you do, is start considering airway when you're considering occlusion and bruxism. And if you start looking for this stuff, you're going to just start seeing it everywhere, I promise you, because it is everywhere. So think outside the box. And a lot of these patients have fraction headaches and so forth. You may find that the people are bruxing their teeth at night because of their collapsing airway. So, what do we do best, Rich?
We do best at teaching dentists systems. That's what we do at Dental Sleep Solutions. So you want to build a sleep practice, or you want to implement sleep into your practice, you've got to have a system for doing it. You can't just take a 1-hour webinar and then go back to your office tomorrow morning in your morning huddle and say, man, I listened to these 2 great guys talk last night, and we're going to do sleep, right? Starting right now. You got to be smart about it, but you got to have a system in place. You got to have a plan, and you have to educate yourself. It doesn't happen overnight. Right. You have got to learn all of these terms. You have got to learn how to do this.
And it's not hard, and it really doesn't take that much time, and we've got a lot of it figured out. Anybody, again, who joined us late and wants to try the system for free, just type in free trial, and Eric will talk to you tomorrow about doing that. We got some live courses coming up, too, that if you put in course, you can get a couple $100 off, which we'll show you in a little bit. The system, gosh, we didn't have a system when we started, and that's why we had to develop one, because dental sleep is really quite simple compared to most dentistry, but there's a lot of little bitty parts that go to it, and when you add all those up, a lot of people get bogged down and just don't implement it as well as they should. The parts, if we want to hit the big ones, are the screening, testing. You got to have a patient management system. You got to deal with insurance, and you need a lab to work with, and we've already made it clear that Keller Lab's one of our preferred labs, and they do the majority of the devices we do, and so that one you can check off pretty readily. We'll talk about each of these other ones in a little bit, but is this where everyone should start, I think, is getting a good screening system?
Well, the lowest hanging fruit, right? We get asked this question all the time. Where do I find my sleep patients? They're the ones walking through your office, right? So you got to have a system for how you do this. It can be as simple, okay, as taking an Epworth sleepiness scale and putting it on your letterhead. So you're just looking at how sleepy a person is, right? But the system we have, we're kind of techie people, and we have a tablet, and we have an electronic screener that you do and all this stuff, which you can keep track of it. You can reward team members and all kinds of things like that. But you got to teach yourself and your team a little bit about this, because when you think about in your practice, you as the dentist, okay? Your practice is going to get 100 questions tomorrow, and you, the dentist, are only going to get asked 8 or 9 of them. So the other 90% of those questions are going to be asked of your staff. So you got to get your team members on board as part of this, and everybody has to buy into this. But the system itself is just to identify people who are at risk, right? So if we talked about reviewing medical histories, and we have these red flags, right? If we take basically every adult patient who walks through your door at 20 years old or older, right? You give them some type of screening mechanism, and you do that. And the important thing is to simply voice your concerns about what's going on with this, right? Don't put your staff behind. Don't put your hygienist behind, right? You're simply trying to identify people who are at risk, right, and voice concerns over that. And then what do you do next?
Well, we got to get our patients tested. And by the way, I see there's a hand up or two and some questions. You type the questions in, we'll answer them along the way, and then we can unmute you here at the end and get your questions. So we'll be finished with the presentation in under 10 minutes, and we'll stay as late as necessary for any questions. So bear with us. We want to make sure we respect everyone's time and get finished on time, but we will stay as late as needed to answer any questions. So, so we got our patients screened. This used to, I think, Rich, this was one of the main reasons that we started Dental Sleep Solutions in DS3. And because it was so challenging to get our patients tested. You used to have to go to the sleep lab. That's what this PSG is, to get tested. Now, the HST, which stands for Home Sleep Test, is available. And there's different systems out there. We work with different companies, with different providers to do that, and we help teach our dentists how to quickly and easily get their patients tested. And there's not really a one shoe for everything, but we have all the different shoes that you need to make this a system that works in your office. And the majority of the time, it's done at home, but we still do them in lab. And the take home here on this is, this is by far a step that used to be a really tall and difficult step to traverse. It's now a much easier step to accomplish in your practice, and we have systems in order to do that. But it's not going to do our patients any good or you any good to screen your patients and say, hey, this person's at risk, unless we have a way to see if they really are at risk. And we have to work with our healthcare professionals to do that, and we can certainly share with you on how to do that. And we even do other webinars on just that subject, so it's kind of complicated to explain in a 1 hour webinar. So once they are tested,
I like that bottom line there, Guy.
Yeah, that's your line, by the way. I'll back it up.
Act like you've done it before. Fake it till you make it, right? So you got to start. You got to start somewhere, and you just act like, hey, this is part of the deal. But you're assessing somebody's risk. You're helping them get their sleep test done, right? And again, we talked for hours about all this kind of stuff, but we're walking people down a path. This is a guy that walks in your office. He's getting his teeth cleaned and he falls asleep. I used to think that was because I was a good dentist, right, Guy? And, now we know there was a problem there. So we're going to screen him, then we're going to help him get a sleep test. And then we got to have some way to organize all this stuff. We got to have some way to keep track of all this stuff.
Yeah, and there's a lot of stuff. We could go through each of this in detail, and it would take another couple of hours. But again, we don't want this to scare you away, because all of it's easy. Doing a sleep exam, doing a TMJ exam, evaluating symptoms and having a system for following up with evaluating symptoms and which device to use, writing letters, progress notes, all the questionnaires we need. All these are just, compared to doing a root canal, implants, crown, even a two-surface composite filling is technically far more difficult than any of this. But you got to have a system for doing each of this, and if you don't, you'll get frustrated, you'll forget things, and you and your team won't enjoy doing this. When these systems are in place, this is perfect. And I would say that's, when I say what do we do best, we help dentists do this, and we help dentists implement systems, and we have systems for each of these little moving parts. So again, we can talk more about that in a second if anybody wants more information. And I think this is the last and maybe arguably one of the bigger pillars, as far as I'm going to show some pillars in a bit, as far as these are the key things we have to do to hold up our dental sleep system. And insurance.
I would even say, Guy, that's probably the Achilles heel of dental sleep medicine, because you're crossing a line from dentistry into medicine here.
Right.
Okay? And it just doesn't behave the same way. Okay? Our physician colleagues started dealing with insurance long before we did, and they're just so much ingrained in the patient's ideologies about what they expect to pay for and not pay for. But you've got to have a plan for how you do this and what you do, and you got to take into account the physician's perception, because they don't want to refer a patient to you and you say, oh, it's $28 million to do a sleep device and we don't deal with your insurance.
Right.
But that physician's not going to want to refer you any other patients. So you have to play the game a little bit, and you have to learn it. So the less the patient's got to pay for this out of their pocket, the more cases you're going to do. It's not much more complicated than that. You can't make it any more simple than that, right, Kai?
No, and the good news is there's people to help you with this. We were early adopters on this, and now is probably, and I would say probably, it is the best time to get involved in this. And there are companies that we work with, including our own, that we do the billing for you, and it's all seamless. And this huge hurdle now has been reduced to just a minor step that needs to be accomplished. And gosh, what we would have given for that kind of help 13, 14 years ago when we started with this. So, just to make it simple, it's really not hard. We got to have a system to screen our patients. We got to have a system to test. We got to have a practice management system, which is where DS3 runs in. But again, we as Dental Sleep Solutions help with all these. And then we had something for insurance billing. I don't know. I just went through our billing for the last month, and I know that we do the billing for I think it's in the hundreds now of offices. It was close to that, if not. And we do thousands and thousands of claims, and it's so much easier than it used to be, because you have experts that's all they do is help you with this aspect of it. And once you get confident at it, then you'll do it yourself. But why take on all the weight of learning how to do this on you and your team to start with, when there's people like us and other people we partner with to help us. And these next few slides, I keep saying everything's important, because all of this is important. But we look at things through our little glasses in the United States, and our little world and our little neighborhoods. And the rest of the world's not always the same. And even in industrialized countries, if you look at the COAT is basically dental device. It stands for what is it? Continuous open
airway therapy. Yeah.
Right. That's a terminology used globally for dental devices for airway problems. And look, in the United States, it's roughly 5% of the people who actually have apnea get a dental device versus 95% CPAP. Look at other industrialized countries, some of which have healthcare, national healthcare. In some countries, Sweden, it's more people get dental devices. We are so out of whack in our country, and the tides are starting to turn and need to turn. Frost and Sullivan, who is a really big company that researches market trends, and this came out 6-8 months ago, not quite a year ago, I don't think. That currently there's about 180,000, 190,000 dental devices done annually in the United States. And they're predicting in the next 5 years that's going to go up fivefold, so over 1 million. And so it's a matter of who's going to do this. This isn't Dental Sleep Solutions and DS3 or Guy and Rich opinion. This is from a trend analyzing company that is saying this is it's time for this to happen. And I think this is really a true analogy. When we started, Rich, this was just a big, huge forest. and we started with sleep testing, right? Let's tear down a few trees. Oh gosh, what about insurance? Gosh, they didn't pay for this. Medical insurance paid for none of these devices when we started. Now they do. Now there's companies to help you. Now we have systems in place. So we tore down trees. All of us who started doing this originally, over a dozen years ago, and we laid down a foundation. We laid down a track, and the train's revved up, fired up with coal, and it's ready to go, and the dental sleep train is ready to head down the track. all you really got to do is get on it. It is literally the perfect time to get involved. So we hope that if you're not already involved in dental sleep, that you get involved. If you want to, if you're doing some of this and want to try our system, our DS3 system, just type in free trial, and Eric will get in touch with you tomorrow and get that all set up for you. And it's not just software. There's 10 hours of CE built right in that you can tap into. That's from beginning information like this, the home sleep test that you actually get AGD credit for. You can even try that out during the couple-week free trial. So our staff will be happy to answer questions. So, I mean, just literally, if you're looking into this, it's a great way to get started. And then these courses that we do, we're doing one in a few weeks in Philadelphia, Canton, Ohio, Rochester, New York, Indianapolis, Denver, and Phoenix.
What do you get with that course, Guy? It's 2 days. What all's included?
The doctor gets a sleep test, a home sleep test. Usually done on them, but you can do it on a team member if you prefer. So you get to experience that. I mean, that's normally a few $100 at the minimal value. You get a dental device made on yourself, ideally, but if not, you can do it on a team member. Again, that's at least a $300 value that you can use to wear yourself or use for a model. You get 2 days of education on how you absolutely do this in your practice. This isn't 2 days of why apnea is related to diabetes. It's 2 days of here is how you do this in your practice.
How to actually implement this.
Absolutely.
Exactly.
Absolutely. And if you want to come to this course, it's normally $9.95, includes you and a team member. I don't think I mentioned that earlier. So the team member is included in that. And if you type in a meeting, and if you know the city, type the city, Stacy will get in touch with you tomorrow. And if you register by the end of the week, you're going to save $200. So $7.95, which is, I mean, incredible bargain. I can tell you, we do these all over the country, and we have very, very good reviews. People come, and sometimes our members come. A lot of times new people. Regardless, people are very pleased with it. I think we do a very good job. I'm proud of our courses. I really am. So that's it for the presentation. There's our information, and let's see if we got some questions answered here, Rich. There's how you get us on the internet. And also, if you want to send us an email, info@dentalsleepsolutions.com, or like again, you can just type something in the question box there, and we'll contact you. And there's another way of contacting us. I think someone had their hand raised here, Rich. Let me see who that is.
I think I've got all my questions in the hand. Yeah.
Did you? Okay. You got that? It's okay. Cool. Okay. Well, look at that, man. We're on. Right on time. 3 minutes to spare. If there's anybody else typing in any more questions, you're the one looking at that right now. Let's see here.
Yeah, I think we're good on that. We'll hang out for a couple of minutes and talk. Everybody, we've had a couple of questions, about the course itself. And again, I think the reviews that we get from our course is that consistently, this is the best course I've ever taken about how to actually do this in my practice. We spend, I think when we first started doing this, Guy, we get up and we talk about sleep and the stages of sleep for an hour, right? Which actually put everybody to sleep, right? And now we just briefly talk about some of that stuff. I mean, do you need to learn some of that? Yes, absolutely you do. But our course is much more about these systems for how do you screen somebody? How do you get your arms around this entire thing? Get your team on board. We do some role playing. We talk. We actually do a consultation with somebody. We do a lot of, if somebody says this, what would you say? We give you word skills to talk about how you talk to your patients about this. So it's all about how to actually do this in your practice.
And we've had many people, I would say hundreds even, who've been to other courses, who this may be their second, third, fourth, fifth, 10th course, and they say, wow, finally someone dumped this down and made this in a step-by-step procedure on how to do this, because it was out of frustration and out of understanding that this needs to be made simple. I think that's what we do best, and we do. So that was one of the questions. What do we teach If you want to implement dental sleep in your practice, you'll leave with the knowledge on how to do that and get
Well,
started.
we spend a fair bit amount of time too. The second day, you actually get a device, so everybody gets to deliver devices and get a device delivered. You're going to make some type of bite repositioning device. We're going to take bites on each other, how to take protrusive bites with a couple of different gauges. We're going to talk about we're going to set 3 or 4 people down. We're going to talk about, okay, with patient with this type of bite. It's very class 2-ish. It's very deep. What do you evaluate when you look at what you're doing for a patient? You evaluate their teeth, right? How many they have, how good of retention they have, how straight, crooked they are, their bite. Is their bite shallow? Is their bite deep, right? Are they grinding their teeth? Are they bruxing at night? How big is their master? What kind of TMJ things do they have going on? So again, we're talking about all of those things to help you pick the right device.
Absolutely, and that's just one part of what we do clinically. We also talk about all the steps, how you follow up, what you do at each appointment, what your first check is when you deliver the devices, the verbal skills you say. Everything from how you clean the device to reposition the jaw. One of the questions that's coming in is DS3 available for Windows XP? DS3 is the software itself, and it's all 100% cloud-based. So it really doesn't matter what operating system you have. You can pull it up on your iPhone, although we recommend a PC because it's a bigger screen. So any internet connection, and you can access DS3, and that's as far as the software itself. We do much more than just here's a software. We have a full team of customer service representatives that's their sole job and their sole education is on getting dentists to do dental sleep. So we're proactive. We have a proactive program to help you, and the DS3 software is a cloud-based software. Is kind of the backbone for all for that. So it doesn't really matter what your PC actually is.
Right. You just need an internet connection. If your internet connection's down, you're out of luck. Right. But anything other than that, we support Firefox and Chrome browsers. We don't support Internet Explorer, but we do. The software is with a 1-year contract. It retails at $3.99 a month. If you go to a 2-year contract, where you get a little better rate monthly for that. And at that point, you get our full support in what we do. That includes, by the way, all of the education that's built into that. That includes, we do 2 courses per year, one in Florida, one in Texas, where you and your staff can come for free, just as a DS3 member. In fact, we're getting ready to do one in Florida, right, Guy, in just about a month?
October 9th, yes, for you and one of your team members for free, and then the other one's very reasonable. That's included. It's included, we have webinars every other Wednesday night that are just for DS3 members, and those are member-driven. So you submit your challenges, and Rich or myself, actually one's tomorrow night. If you want to tune into that, we get if you set up the free trial, you can come to that as well. So we just all that's all included in the monthly fee. The free trial doesn't entail anything, so there's no commitment. We're not high pressure people. They're going to set you up with our system, and you can look it over, and you can see what all it includes, and talk to our team about how helpful they are. And if it's not for you after a couple of weeks, we turn it off. It's just that simple. No financial commitment at all for it. Another question here about the bite. The bite can change. We spend a lot of time on that in the hands-on course, talking about the repositioners, the verbal skills, how to prevent the bite changes, and what to do when the bite does change, and understanding the balance between risks and rewards of treatment for apnea. And so that is not anything we should take lightly, but please, please, please don't let concerns about bite changes prevent you from looking into doing dental sleep. If the medical community let side effects of their treatments prevent them from delivering treatment, there literally would be no medical treatments. There's very, very few medical treatments that have no side effects, and most of the time medical
Well,
treatment.
even CPAP, guy, they just came out with a study, nasal CPAP, right? 10 centimeters of water pressure. You got to strap that mask on. You're pushing the maxilla in at the rate of about 1 millimeter, every 12 to 18 months. So
absolutely,
every treatment out there has side effects. Again, we work very hard. We teach you about recapturing the bite. We look at AM aligners and morning repositioners, and we balance that with sometimes using CPAP 1 or 2 days a week. Right? So we teach you a system to where we try to minimize all of those things. Right. We're both dentists, right? We've been doing this as well. We don't want bites to change. We don't want that to become an issue. But it's much less of an issue in our minds than it is yours, because people are alive. People are healthy. People are happier. They come in and give you hugs, and they bring you carrot cakes and make you fat, right? Things like that, because they're engaging life again, and they're doing that. And even when their bites start to change, you can't take their dental device away from them. They won't give it to you. No.
I would say that for dentists getting started in dental sleep, bite changes are on their top 1, 2, 3 concerns. It always comes up.
Right.
If you ask 100 dentists who do a lot of dental sleep, and where that lies on the challenges, it's way down on the list. It just isn't. It's nothing we should ignore, but it isn't something that even stresses me on. There's a lot of things that are up above it on the list, and most of those aren't even that big of challenges. So please don't let that.
Don't let that deter you. We want you guys to get involved in this. We want you to do this. We need more dentists out there doing this.
That's part of the problem.
It is part of the problem.
Yeah, I mean, even if the physicians decided tomorrow to go by their own standards and start offering dental devices like some of the other industrialized countries, we couldn't handle the flow. If they just turned the valve on tomorrow, we would it would fail, and then they would go back to doing what they're doing, because there's not enough dentists that know how to do this to handle the current need, which the need's going up daily because more and more people are.
You know what? Dr. Rimmer's guy. He's a good buddy of ours, and he was at our meeting and our member meeting in San Antonio, and some guy's talking about AutoPAP, right? And just in passing, Dr. Rimmer goes, "Oh yeah, I invented that."
Yeah. Okay. He's a physician, and he and I teach right. He and I teach down at the Pankey Institute, and he's one of the guys that invented it, and he's also one of the biggest supporters of dental devices, because he realizes even though their original solution works sometimes, and a lot of times it works, but a lot of times it doesn't because the patients can't tolerate it. So that's why he spent his last 20 or 30 years, working on other things other than.
But what he said, guy, too, was though he said we're falling behind at the rate of 7 million people a year in the United States alone.
Right.
In other words, 7 million people are developing sleep apnea that we haven't even diagnosed or treated. So it's not just the 90% that haven't been diagnosed, but more and more of us are getting fatter, and more of us are getting sleep apnea. So there's enough out there for all of us.
Well, it's 8 after 9. I know someone just typed in. You certainly don't have to stay, to hurt our feelings or get your CE. We were just wanting to stay on in case anybody had any further questions. So not trying to keep anybody up, including myself. So hopefully we have answered most all the questions. I don't see any more coming in now. Again, if you want to know more about our stuff, there's our contact information. We will be doing another Keller webinar. I think it's next month, and I forgot the subject. So, you'll be getting, if you got an email for this one, you will get an email for that one as well. And I know we have at least 3 more coming up in the next 3 months. So, hope everybody enjoyed it. We enjoy doing this kind of stuff, as you can imagine, as you hopefully felt and heard in our passion and desire to educate dentists. So, thanks.
Thank you, Guy, for putting this together. It was real easy for me just to log in and eat dinner while doing all that stuff. So, thank you, guys. You guys have a good evening, and we look forward to working with you in some way or form or fashion.
Great. Have a good night. Bye bye.